Good afternoon, everyone. My name is Jamie Harwood. I'm the coroner for Peoria County. Welcome to the Health Department today, and thank you for joining us for this brief update on COVID-19. We're here today to provide additional information regarding the death in Peoria County yesterday. First and foremost, I want to extend my heartfelt condolences to the family on behalf of myself, my office, and the Peoria County City Health Department. Generally speaking, my office doesn't come forth with information regarding deaths related to a medical cause. There's generally no reason to do that. However, this situation's a little bit different in the fact that the death was related to a virus that's taking over most of the United States and multiple other countries. The gentleman who we're speaking of was a 91-year-old male who was hospitalized at Unity Point Methodist. He passed away at 3:59 p.m. yesterday. The male resided at one of the independent assisted living facilities here in Peoria. At this time, I've thought about this all night last night, and I've thought about it this morning, how much information we wanted to release regarding his death. Many people are going to wonder, did he have comorbid conditions, and what was his health condition before and after, and some of that is relevant, and some of it's not. What I feel to be relevant to tell you is that he did have comorbid conditions and he was sick for the last week or so. I don't feel it relevant to release his name either, and there's a reason for that. Most often, we don't release names of people who pass away from a general medical condition, which I consider this to be a medical condition, albeit related to the virus. The second reason I don't want to release his name is a little bit more personal. I did not know this man, but I know his family. And I know this man at 91 years of age has a legacy. I don't know what that legacy is, but those that know him and that love him and that descended from him know of that legacy. And I do not want his legacy to be the first death from COVID-19 in Peoria County. With that, I'm going to introduce Monica Hendrickson to finish this.
Thank you, Jamie. Good afternoon. We recognize that our community would, like so many others within the state, this country, and this world, be faced with reporting the death of a resident testing positive for COVID-19. It doesn't make today any less difficult. Our thoughts are with the family and friends during this difficult time, and we respect their privacy as they mourn. In regards to the daily update, the Tri-County has currently 30 cases to date, which is an increase of 4 from yesterday. Peoria County has 11 cases to date, an additional 1 case from yesterday. Tazewell County has 13, which is 3 additional from yesterday, and Woodford County remains at 6 positive cases. In addition, moving forward, any deaths related to COVID-19 for the Tri-County will be included in the daily briefings Monday through Fridays. In regards to the hospital data, persons under investigation in the ICU are at 7. COVID confirmed cases in the ICU are at 8. And persons under investigation or confirmed cases of COVID that are in non-ICU beds is currently at 32, which is a 12-bed increase from yesterday. In regards to what Jamie spoke of in terms of our long-term care facilities, I would like to take this opportunity to discuss what facilities within Peoria County have been working on. Early in the response, the Joint Emergency Operations Center between the City of Peoria and the County of Peoria recognized the impact the virus would have in congregate living settings, including our long-term care facilities. The state of Illinois aggressively set protocols and guidance for long-term care facilities when we pushed out and connected with those entities to review and provide support. This began with early online surveys to assess their capacity and adherence to any restrictions, providing education and monitoring and screening of staff and residents protocols, infection control practices, and PPE and supplies. The Peoria City County Health Department identified staff whose singular role in our response is to work with local long-term care facilities. This provided ways for us to push information quickly, set up our long-term care facilities with alerts and supply chain needs, as well as assist in any reporting. These aggressive policies to curb the spread included visitor restrictions, cancellation of non-essential activities, and limiting residents to adhere to social distancing. Our long-term care facilities in Peoria County routinely monitor the vitals of not only their residents, but on their staffs throughout the day. They've limited congregate activities, including food services when applicable, and are using universal masking and enhanced environmental and disinfection practices. We at Peoria City County Health Department conduct weekly phone calls to discuss changes and any best practices, as well as to provide our long-term care facilities a daily connection when assigned to that one point person. The long-term care facility is working in coordination with our staff today, providing this with vital logs of their residents and staffs, contact listings, linkages to other employers, and informing residents and families. They are currently under a lockdown policy and are further limiting their residents' access as well as decreasing staff rotations. Our number one priority is the health and safety of our community, and we continue to ask individuals to stay home, even for essential services, use delivery and other methods when applicable. Clean your hands often, clean and disinfect, cover your cough and sneeze, and contact your healthcare provider if you are sick. The only way to stop the spread of this virus is to make it difficult for it to spread. So self-distancing and reducing exposure is the strongest and most important intervention that we can do as a community. Jamie, myself, Mayor Artis, Chairman Rand, as well as Dr. Stoner are available for a Q&A.
Which independent living facility was it?
At this point in time, we're not going to announce the long-term care facility. They're currently working to notify all of their clients as well as their staff. They have given us a provider's information for media questions that the Joint Information Center will push out once they've completed all their notifications in-house.
Okay, so once that internal communication's been released, you will be releasing the name of that facility to the public or to media?
To media, as well as the contact for them to answer any questions that you guys would have directly.
Do we know if any other residents in this facility have tested positive for COVID-19 or been tested for COVID-19 at all?
There is one other resident that has been tested for COVID, but that is a very close contact. In fact, it's their significant other.
Okay.
But based on vital logs that they've been providing, which include temperatures, symptom checks, and even blood oxygen levels, there are no residents that are currently symptomatic in the facility.
So are you currently doing contact tracing to figure out who else this couple may have been in contact with?
Because of the timeline of this, the facility was already in very extreme visitor restriction and protocols for their staff. So a lot of our contact tracing is looking at who else has been available, looking at staff, looking at where staff may have also be employed in other locations, recognizing that does happen in our long-term care facilities, and doing that contact tracing right now. Yes.
Is this going to, I know there's already a lot of restrictions in place on who can enter a long-term care facility of any kind in an attempt to guard against this. Is this going to result in any additional, protections or lockdowns or anything of that sort?
Really, a lot of our long-term care facilities are at high alert. When we recognize that many of them were affected, especially in the Washington area, there was an aggressive push initially. So a lot of what they're doing is even further limiting their staff's rotation and exposure with their residents.
And when we talk about, I guess the facilities themselves, I guess just what are they doing? You mentioned something about logs or vital logs of their reporting. Can you talk a little bit more about that?
So all of our long-term care facilities were given strong guidance about how to monitor and keep those logs, and it's looking at temperature, blood pressure, heart rates, oxygen levels, as well as symptoms and exposure continuously for a few weeks now for the residents in their long-term care facilities. So they have that available, and they're sharing that with us so that we can help monitor and continue to watch to see if there's any new cases that might also appear, not only in this long-term care facility, but recognizing the fact that all of our long-term care facilities are very vulnerable, especially to this virus, and we applaud their efforts to really be aggressive in taking on that approach here locally.
Is there a standard set by IDPH or CDC in terms of how often they should be taking temperatures or, compiling these logs? Is it like once a day, several times a day?
At minimum, every 8 hours.
Every 8 hours?
How long was this person in the hospital?
I think Jamie can actually answer that a little bit more as well.
I believe the person was hospitalized under 3 days.
And were they using a ventilator?
That I don't know.
You mentioned other conditions they had. What were they?
You know, I don't want to release part of his medical condition, but, and I know I've heard Monica address comorbid conditions over the past few weeks, but those that are most vulnerable and at risk are those with chronic obstructive pulmonary disease, or COPD, asthma, heart disease, congestive heart failure, even renal failure and things like that can affect how someone's going to recover from this illness, especially respiratory illnesses.
And since this was your first time examining someone who passed because of COVID-19, what, like in your eyes, were you looking for in this? Basically, what the autopsy?
Yeah, you know, like with most of our cases that we go through, a lot of it's differential diagnosis. For example, if this gentleman would have passed away and had all of these symptoms of COVID-19, but had a negative test, we would be looking at differential bacteria or viruses that may have been included in his death. But this gentleman actually had a positive test, so that was easy to rule it in. But otherwise, we use differential diagnosis. Sometimes it's not as clear as what we would like it to be, for sure.
So, Jamie, just to clarify for the general public, so if somebody's a comorbid condition like COPD and they contract coronavirus or COVID-19 rather, and they pass away, will their death be classified as a COVID-19 death, complications due to COVID-19? I think there's a little bit of confusion among the public of how you determine that.
I think that's a great question, and I think I've been in angst over this for the past 3 weeks. And that's a great question. How do we list cause of death? And really, what is the cause of death? When we look back historically on our death certificates of people who die from a pneumonia, we don't name the bacteria of the pneumonia that caused the death. We simply would relate that to maybe sepsis pneumonia, and that would be the cause of death. In this particular instance, and I think for data traction purposes and epidemiology, we would have to know that the COVID-19 related to the death in some form or fashion that exacerbated maybe the COPD condition. So a death certificate theoretically could read exacerbation of congestive heart failure secondary to COVID-19 infection. And we'll address that on a case-by-case basis, but I think that's a great question.
Do we know how he contracted it?
I don't know how this particular gentleman contracted it. When I was on the phone with the hospital, they didn't have that information as well during our original investigation. But I think Monica might know that information. I know the Peoria County City Health Department is investigating those points of contact, probably as we speak, to be honest.
Thank you.
Is there any further questions?
Do we know where they contracted this virus, or
Oh.
that's still being investigated?
That's currently being investigated. That's part of the contact tracing that we do with any positive or any even presumptive positive cases. We go back and do an extensive contact tracing, notify those individuals, and kind of also work backwards. And I want to really highlight big changes that the Centers for Disease Control and Prevention, the Illinois Department of Public Health, really focused on, and that is the fact that 48 hours before someone shows symptoms, they can be symptomatic. So when you are what's known as asymptomatic, you can still be spreading the virus. And that's why we want to take this time to reiterate the fact that individuals out there, it is just because you may not have a cold or a cough or a fever doesn't mean that you are free and clear. And really, again, to keep operating under that expectation that I am possibly exposed or can transmit the virus to other individuals. So rather than trying to determine causation or correlation, recognizing the fact that we can all be actually transmitting the virus, and made to take those protocols as well as those steps to really control the spread of it, because that is going to be our best defense on this.
And do we know how long he showed symptoms before he did pass?
Again, that's part of the investigation right now. With that in mind, thank you all for coming. We will see you again on Monday.